Hi everyone. I don't know where my webcam went. Okay. Anyway. Okay, I'm so sorry about that. That was so random. I just got in a fight with the computer. Okay, so today we are going to talk about patient-centered care. Um, so there's four concepts with patient-centered care, and we're going to talk about them more, but there's dignity and respect, information sharing, participation, and collaboration. The reason why patient-centered care is, the end-all be-all at this point is because it's shown to improve outcomes. So patient-centered care is providing care that's respectful, responsive to the patient's preference, needs, and values. And our orientation to healthcare needs to be patient-centered because patient engagement is an essential precursor to quality and safety. So your book talks about the different, definitions of patient-centered care, like the Pickler Institute defined it as improving healthcare through the eyes of the patient. So that looks at effective treatment delivered by staff you can trust, involvement in decision and respect for patient preferences, first access to reliable healthcare advice, which is so important. You want to trust who is giving you medical advice, fast access to reliable healthcare advice. Oh, I'm so sorry. Clear, comprehensive information, physical comfort, clean, safe environment, empathy, emotional support. And, when we talk about patient-centered care, especially when I worked in the inpatient unit, I used to kind of give one of those eye rolls, right? Because it would just be so frustrating. But there's a difference between patient-centered care and patient-demanding care. And so the idea of the patient-centered care is you center the patient in the center. And the point of view has to come from what they need and value to engage them more in order to have better outcomes. I want to give you an example of this. So you're in the hospital and you have end-stage cancer and you're there for pneumonia. Patient-centered care means your individual needs are put in the center. So are you going to get treated for pneumonia? Now, are you older and already vent dependent? Maybe that's not the way. Maybe getting treated for the pneumonia isn't important to you. Are you a young mom with 3 kids that every single extra second on this earth is something that you strive for? Then treating the pneumonia is a way to go. So, and then engaging the patient. So, if you say to a patient, the only way, or engaging a patient. So, if the only way to treat someone is through a surgery and they want to get treated, but they don't want to go through the surgery, meeting them in the middle and explaining it to them to get them engaged and empowered, they might take more ownership of their illness. So core concepts and principles of patient and family-centered care. So let me just close in on this a little bit. All right. So dignity and respect. People are treated with respect and dignity. Healthcare practitioners listen to and honor patient and family perspective and choice. Patient and family knowledge, values, beliefs, and culture backgrounds are incorporated. Now, if someone's completely ignorant, obviously you're not going to just do something because they don't know any better, but taking that into account in order to provide care is essential to respect the patient and eventually get them to come around to the options that they have. Information sharing. Healthcare providers communicate and share complete and unbiased information with patients and families in ways that are affirming and useful. Patients and families receive timely, complete, and accurate information in order to effectively participate in care and decision making. So an example for this, I took over a clinic and I took over from a different provider who is a very nice person, but had a different kind of approach, an older approach to medicine. Who's an older doctor. And I would say to a patient, okay, so you're diabetic. and they'd be like, what? I'm diabetic? Well, they were very early diabetic and no medications were needed. So maybe the doctor felt like having them come in and talk about what that means was not warranted at the time. But sharing this information in a timely manner will help prevent the diabetes from getting worse. Instead of just waiting for medicine to happen, let's prevent from needing medicine to happen. Participation. Patients and their families are encouraged and supported in participating in care and decision making at every level to choose. Individuals and families build on their strengths through participation in experiences that enhance control and independence. And why is this going to help outcomes? Why is this going to promote safety? Well, when a family is able to participate, you have to think of it in the micro and macro aspect. In the macro aspect, you're thinking big picture. The family and the patients involved, they're more likely to comply and they're more likely to have better outcomes. They're more likely to listen to you. But also in the micro setting, if you have a patient who is having delirium at night because maybe they have Alzheimer's and they're sundowning, or they have ICU psychosis, or they're withdrawing from alcohol. You know, before we didn't really involve the family. So maybe we sedated them or we restrained them. And there's so many bad outcomes and safety issues with restraints, both medical and physical. And so getting the family involved. Okay, what is your goal? I don't want my mom to be restrained. I don't want my mom to get pneumonia. Okay, well, can you meet us halfway? We don't have enough staff to sit with her. Can you send different family members? So that's a participation aspect. Collaboration. Patients and families are included on an institution-wide basis. Collaboration among patients, families, and providers occur in policy and program development, healthcare facility design, and professional education, as well as in the delivery of care. So not just individualized to the patient's stay or the patient program at that point, but institution-wide. So where in your institution are you involving patient-centered care? Are you asking families and patients to be included? Perhaps when when you make the patient satisfaction surveys, that input being taken into account when you implement a new policy is an institution-wide change. So the Institute of Medicine, healthcare should be based on continuous healing relationships. Care should be individualized. It's important for patients to be involved in their own care decisions. Patients and families should have improved access to information, and healthcare should be more transparent. That's from the Institute of Medicine. So growing body of evidence shows that improving the patient experience and developing partnerships with patients are linked to improved health outcomes. For example, evidence shows that patients who are more involved in their care are better able to manage complex chronic conditions, seek appropriate assistance, and have reduced anxiety and stress and shorter length of stay. So an example of this in the outpatient setting is I started a group diabetes visit, which means I have 6 or 7 diabetics coming in for one visit. And we have interdisciplinary team members come in and help manage different aspects of care. And they're 3-hour-long visits, it's managing complex chronic conditions, and people are now coming out of the woodwork. Hey, you talked last week about eye care. I need to get my eyes checked. My feet feel numb. You talked about that with me. Can we talk about my diabetic foot exam? And there's really an overall reduced sense of anxiety over their diabetes, which is, quite a medical burden. Quality is more than technical quality. The patient and family's experience must be a driver for quality improvement. So a lot of times we just use metrics, which I love metrics. I love my informatics system. I love looking at the technical data, but we also need to use experience to drive quality improvement. Because in the end, if someone has a bad experience, they're less likely to follow a plan. And if the patient's not involved, that's it. Unless you're sitting there pushing the pills down their throat, getting them to exercise at the grocery store with them and forcing them to buy fruits and vegetables, your plan goes out the window. So patients and families experience are going to be a quality improvement driver. So if, just a one-on-one visit telling you what to buy is not helpful with diabetes nutrition. Maybe a class where somebody takes 10 or 12 diabetics to the grocery store with their SNAP card or with their budget and teaches them how to buy healthy food on a budget. That is a way to drive quality improvement.